This screencast will be about strong analgesics, and what we're going to do is compare the structures of morphine, codeine, diamorphine, which is called heroin, and discuss the advantages and disadvantages of using morphine and its derivative as strong analgesics. So as you recall, strong analgesics, also called opiates or narcotics, they've been in use for over 5,000 years. The three types that we're going to focus on: codeine, morphine, and heroin. And the interesting thing is that these all are derived from the poppy plant. And the order in which these are listed, again, is the order of effectiveness and also severity of side effects. So if we look at the structures, again, there's no need to memorize the structures. You'll have the data booklet, but you do need to identify the the functional groups within each structure. So if we take a look at morphine, we've got the benzene ring, we've got the ether, we've got an alkene, we have an alcohol, actually two alcohol groups, and this amine is a tertiary amine because it is connected to the three carbons. The OH grouping here makes morphine soluble in blood. You should focus on the, I jumped the gun. We have codeine in the middle. Again, you've got the benzene ring, you have the ether, you have that alkene, you have an alcohol group, and again that tertiary amine. For heroin, you've got a benzene ring, a ether, a alkene, an ester, and again that tertiary amine. So they are very similar in structure, kind of changing really just these groups coming off of the benzene from a phenol to a phenyl. Alright, so therapeutic effects. And what we want to do is, one important thing to note, this grouping here, this ester up here, this it's made by taking actually morphine and reacting it with ethanoic acid. This makes it more soluble in lipids, and that allows it to cross the blood-brain barrier. It crosses that barrier quicker. This diamorphine or heroin is called a semi-synthetic. Okay, so therapeutic effects. The strong analgesics are better for relieving acute pain. They can be delivered intravenously, parenteral. They induce relaxation and they can improve the quality of life. They are also a anti-diarrheal. This could be considered therapeutic or not. It depends on the condition of the patient, and it does reduce coughing. Relieving the acute pain, remember these work on the pain receptors in the brain itself. When we deliver drugs intravenously, there is a much quicker effect because it's delivered right to the bloodstream. All right, now let's take a look at the side effects of these drugs. The side effects of these drugs are significant. Okay. There is a lack of self-control, sometimes described as a euphoric state, and this could lead to risky behavior that an individual normally would not exhibit. They are addictive, with heroin being the most addictive. There are withdrawal symptoms like night sweats and severe anxiety. There is a big tolerance effect with these strong analgesics. Okay, if somebody takes these on a regular basis, they build up tolerance and can quite frequently lead to a drug overdose when you reach those toxic levels. They can result in kidney or renal failure, and of course all of the risks associated with the intravenous drug administration, things like HIV and AIDS and hepatitis. The addictive nature of these drugs can result in weight loss, lack of an appetite, and an unwillingness to care for yourself. The drug takes over the need for that second, or the next high kind of takes over the life. Right? You probably have heard of methadone, or maybe not. It's a less addictive substitute for heroin. It is another analgesic. It is a less addictive, and it has a longer term before those side effects start kicking in, and it's typically given to heroin addicts to get them off of the heroin.